Many studies and articles conclude that punishment is not an effective method of controlling behaviour in children. To at least some degree, most studies show that children who are subjected to punishment have a negative response either in their development or in their behavioural response to punishment. However, those studies were fairly limited in their scope because the variables were not wide-reaching enough to capture evidence of any other factors apart from the punishment itself affecting the subjects. As we know, in real life, experience is made up of a number of elements, and we must be careful to ensure that we are looking properly at all relevant factors before drawing conclusions as to what effect something has on the subject. A compelling 2012 study out of Columbia University is the subject of this presentation. It was novel as it examined the incidence and prevalence of punishment, in this case specifically spanking, of children aged 3 through to 5 years and the correlation between spanking and subsequent externalizing behaviour and verbal receptive ability. Recognising that spanking and other forms of corporal punishment has increased behaviour problems in children, the study asks, is it the frequency of the punishment or the severity of the punishment that is the main player in the subsequent behaviour, and looks at the punishment in the context of many other things that a child experiences simultaneous to the punishment. We can see that children often mirror the behaviour of their parents. Parents tend to punish children more when they display antisocial tendencies. Perhaps children develop antisocial tendencies due to being punished. Punishment adversely affects children's socio-emotional state and likely affects their learning and development. How about factors like ethnicity? Well, the study sought to determine if it plays a role in the effects of punishment on antisocial behaviour, together with many other variables I'll outline in this presentation. The aim of the study was to determine whether the strictest statistical controls for certain variables affected the results previously yielded in studies on the effects of punishment on behaviour, and sought to determine whether there were any lessons for parents in terms of how to modify the punishment model to yield better outcomes for the child. The study was impressive for its range of factors considered as being possible contributors to outcomes for externalising behaviour and verbal receptive ability. That is to say, the authors didn't simply look at punishment and outcomes, but rather they looked at a number of environmental, social, economic and nurture factors in conjunction with the punishment. This reduced the chance for observational bias, making the results more compelling. The researchers hypothesised that regardless of other factors, punishment would still be shown to be detrimental to behaviour. The researchers used a subset of data from a longitudinal study of children. This study was known as the Fragile Families and Child Wellbeing Study, conducted across 18 large cities in the USA, and the authors of the research paper relied on a subset of subjects from this study. The data was collected based on many variables, namely child-level variables, maternal and family characteristics, prenatal risks, maternal risk factors, the normativeness of spanking, past child outcome measures, and a pooled cumulative risk factor. The data was collected from families, starting with a baseline interview with the mother and the father, after the birth of the child, with follow-up interviews by phone and correlating home-based interviews when the child was 12 months, 3 years and 5 years. In other words, a good snapshot of the child's experience and exposure. The researchers of this paper focused on 1,100 families for which spanking was prevalent in that study, and applied both a child behavioural checklist review of externalised behaviours at age 5 and a review of the child scores on the Peabody Picture Vocabulary Test at age 5. Applying the data, the researchers created 4 models. Model 1 investigated the difference between the effect on levels of externalising behaviour at age 5, where there was either a low or high level frequency of maternal and paternal spanking. Model 2 considered other factors such as the child gender, the actual age of the child at the 5-year assessment, the child's birth weight, birth order and child temperament at age 1, as well as related indicators of family socio-demographics and risk behaviours. Model 3 added measures of maternal functioning and well-being, and Model 4 added measure of earlier child externalising behaviour at age 3. So what did they learn? Model 1 results showed that both low and high frequency maternal and paternal spanking at age 3 is associated with higher levels of externalising behaviour at age 5. Model 2 results showed that child characteristics play a significant role in the presence of externalizing behavior at age 5, meaning that the predicting power of externalizing behavior based on punishment alone does not tell us the whole story. Model 3 results show that a healthy maternal functioning and well-being plus low-frequency spanking is not as likely to cause externalizing behavioral traits in the 5-year-old child as those who experience high-frequency spanking from either or both parents. Model 3 also observes that where the mother is effectively engaged with the child in pro-cognitive activities, neither low nor high-frequency punishment as strongly predicts externalizing behavior, but PBVT scores continue to correlate with frequent spanking. Model 4 results show that where a child displays an early externalizing behavior observable at age 3, he's far more likely to continue to display that behavior at age 5, regardless of whether it is one or both of the parents doing the spanking. However, the high-frequency maternal spanking does still act as a strong indicator of greater externalizing problems at age 5 years. The results predicting externalizing problems at 5 years from spanking at 3 years are consistent with the literature. Spanking is not an effective tool at achieving its goal, and families should be educated to use different tactics. Now, a quick look at the limitations of the study. Parents self-defined spanking in this study, and also weren't required to describe the intensity of the spanking, only the frequency. So there was no control for the level of violence on the child, say a light tap versus an uncontrolled physical rage. So we're no closer to knowing really whether the externalized behavior of the subjects was prevalent in high-frequency punishment because of the trauma and severity of the punishment, or whether the frequency alone played a role. It would also have been useful to measure verbal intelligence earlier than the 3-year-old mark, as punishment may already have affected verbal intelligence by this age, so before the testing phase of the research kicked in.